Great. I think we'll go ahead and get started then. Good morning, good afternoon, good evening. Welcome. My name is Tyler Best, and I am one of the Springboard community managers. Today's webinar, Getting More Bang for Your Buck, Engaging Decision Makers for SBC Financing, is presented by Springboard, an online community under the Breakthrough Action Project. Breakthrough Action is USAID's flagship program on SBC, or social and behavior change. Breakthrough Action ignites collective action and encourages people to adopt healthier behaviors by forging, testing, and scaling up new and hybrid approaches to SBC. If this is your first Springboard webinar, then welcome. So what is Springboard? Springboard is an online community of over 4,000 SBC professionals from over 100 countries. Springboard can help you advance your SBC skills, connect with colleagues and SBC leaders, and get inspired through resources, events, and jobs. If you're not a Springboard member already, join today. So we will be starting today's event with 3 presentations, followed by time for questions and answers at the end. Feel free to use the chat feature on the bottom to introduce yourself and your organization. Also, you may wish to use this feature to ask any questions for the speakers throughout the event. We'll compile those to use during the Q&A session. Now on to the show. Our first speaker is Dr. Olukunle Omotosho and comes to us from Johns Hopkins Center for Communication Programs, where he's a program manager for the Challenge Initiative, or TCI project. Over to you, Olukunle.
Thank you very much, Tyler, and good afternoon, everyone. Welcome to this webinar. This afternoon, I will be talking on engaging decision makers for SBC financing, challenge initiative experience in Nigeria. Next slide. The challenge initiative in Nigeria has a model that is tagged business unusual model. This business unusual model is a platform, and it enables government to scale up high impact family planning intervention in the urban poor settings. This initiative, as we so call it, has been supporting the government of Nigeria since late 2016. We provide technical support to the national government, sub-national government, and also at community level. And we've been able to do this to 14 states, inclusive of the Federal Ministry of Health and also the community levels. The TCI phase 1 just ended last year, and we just started the TCI phase 2. TCI is grounded in 4 foundational interlocking tenets. And these are what we call the high innovative approach in developing aid to strengthen the government of the nation. These 4 foundational interlocking tenets are scale, impact, efficiency, and sustainability. The sustainability part of it helps to deliver the greatest impact for the lowest cost through strategic engagement with decision maker. And we'll be hearing more of this even in this presentation for sustainability. Next slide. The TCI demand generation portfolio is championing local government-led SBC intervention. To properly understand the SBC environment, the first thing we did was to scan the SBC environment. Through this scanning, we use what is called the net mapping exercise. The net mapping exercise helps to highlight the issues and the gap which exist in SBC environment. And 3 major things were identified using the net mapping. Number 1, The SBC intervention are majorly driven by donors and partners. And as we all know, this has been ongoing since now. The second thing that the net mapping showcased was the fact that there are different power dynamics by decision makers on SBC intervention. And there is need to unfold and unravel these power dynamics to be able to understand the environment and intervene adequately. The third thing was the weak capacity of state institutions or agencies to be able to implement SBC. Having understood the SBC environment using the landscaping exercise of net mapping that showcased the power dynamics and also revealed the different issues, we were able to engage with the stakeholders. But before engagement, we identify all these stakeholders and categorize them into 4 major areas. The first category is a category of the policymakers. These are the politicians. These are the people that will approve the release of funding. These are the top government officials that are also called the policymakers. The second category is a category of the technocrats. Technocrats are the people that will run with the vision. The FP coordinator, the RH coordinator, the executive secretaries, and the directors that we have in the primary healthcare agency and also at the ministry. The third category is a category of the community leaders. Among the community leaders are the religious leaders, the head of religious institutions or bodies, the Christian and then the Islamic clerics, also the World Development Committee leaders, the youth leaders, and all the leaders that you could think about in the community. The last category of the stakeholder is the media. As we all know, media is very important in any intervention you might want to do. And all of these were gotten from the net mapping exercise, which you can see in the picture on the slide. Next slide. Having understood the SBC environment and also categorized the different stakeholders, we were able to engage with them strategically. We did not only engage in the normal way. We engaged with these stakeholders using the smart advocacy approach. As we all know, advocacy is the process by which you set an enabling environment for the positive intervention of any activity you might want to do. So we use the efforts of the champions and the advocates, which we all have in our organization, to be able to soften the ground, to be able to engage with all these stakeholders one-on-one and also in group. And what did we get from this engagement? The strategic help us to be able to profile each of these stakeholders, to be able to understand their likes and their dislikes, to be able to understand the context in which they work, to also be able to understand what they value. And then we use all of this information we got from them to determine our ask. And in the course of this presentation, you are going to see how we were able to approach all these stakeholders in determining the ask of finance to support family planning and AYSRH intervention in the geographies which we support. So having engaged with all these stakeholders, having prepared the ground for intervention and implementation, we then identify all the existing structures in the different national level, which is also tagged the state and also the community level. At the point of entry, we understood that some states had what we call the Social Mobilization Committee. Some of them were moribund, some of them were still functional, but we were able to reject some of these committees. Initially, we transformed them from ordinary mobilization committee, which used to work on immunization majorly. They only come together whenever there is any activity from partners and donors, which still re-emphasize the fact that most SBC intervention had been driven majorly by donors and partners. So we set them together. We help them to develop a state-specific SBC strategy, a 4-year strategic document, which contain all the interventions that they needed at any point in time to push forward their points in the area of demand generation and SBC. With this on ground, the SBC Technical Working Group, which we supported to form, which are also working across the supported states now, was able to get some of the interventions, activities they will need to do yearly. And as we all know, every state government used to do what we call state annual operational plan, which they do around November or December against the coming year. So what the SBC Technical Working Group did was to extract some activities that they would like to work on in the coming year, and then incorporate it into the following year's state annual operational plan with the support of other ministry development and agency. They were also able to incorporate a lot of these into the costed implementation plan. Having done that, we also provided technical support to this SBC Technical Working Group to develop what we call SCAT. SCAT is SBCC Capacity Assessment Tool. SBCC Capacity Assessment Tool. This we use to understand the context of the technical working group, to know their weaknesses across different areas. Time will not permit us to go deep into the SBCC Capacity Assessment Tool, but at the end of this presentation, there is a link for you to go online and check for more information regarding SCAT. Next slide. With the whole of this gamut of intervention and technical support provided to the structures like SBCC Technical Working Group, we initiated a model of tracking the financial commitment and actual spent by each of government across the supported geographies. As I said earlier on, we supported 14 states in our phase 1 of intervention. This year runs from July to June, and that's why you could see the bar chart showing intervention and also result from July to June. At the end of intervention, between July 2018 and June 2019, having provided continuous technical support to the stakeholders and to the institutions that have been formed and also strengthened, we were able to see an increase in government funding for SBC intervention, unlike before. At the end of this intervention, a sum of 15,993,300 was realized as part of what government fund in cash, not in kind. And when you try to put this in dollars, you will be getting something close to 38,000 US dollars. A year after, there was an increase of 386% commitment and actual spend from government. It rose to 77,650,000, which is about 188,000 US dollars. And then by the end of 2021, we had 313%. Yes, you might want to ask, why the little decline? It was because of COVID intervention, where government had to realign most of the budget into COVID intervention and all the rest. So this showcases the fact that SBC intervention can be led, can be funded, and also can be sustained by government. Next slide. Conclusion. Strategic engagement of decision makers in a government-led SBC intervention is a best buy for cost-effective and sustainable SBC program. And if you want to get more about some of the documents that we use, you can go online and check the institutionalized state-led SBC capacity strengthening document we developed, and also the SCAT. Thank you very much for your time.
Okay, thank you, Dr. Omotosho. I think that was a great start and sort of a great way to warm us all up at looking through that experience before we move on to our second speaker, who is Nicole Bellows. Nicole is a senior associate at Avenir Health, where she works on the Breakthrough Research Project. And Nicole will be talking through us some resources and tools that we can use for SBC financing. So over to you, Nicole.
Great, thanks, Tyler. Okay. Next slide, here we go. Well, hello, everyone. Thanks for having me today. For those of you who might not be familiar with the Breakthrough Research Project, it's USAID's flagship SBC project aimed specifically at the generation, packaging, and use of innovative SBC research. And this is to inform programming. We work in close collaboration with Breakthrough Action, and one of our critical priority technical areas is looking at the cost effectiveness of SBC interventions. Next. Under the cost effectiveness umbrella, there are two primary objectives which were highlighted in the project's early research and learning agenda process. First objective is synthesizing existing evidence through literature reviews and generating a repository of SBC costs, as well as developing health-specific area business cases, which I'll discuss in more detail on later slides. Our second priority area is looking at generating new evidence for others to conduct SBC costing analyses and specifically cost effectiveness studies. Next. Under the generating new evidence objective, we have generated materials to help guide other researchers who are interested in conducting costing and cost effectiveness studies. First, the SBC costing guidelines details 17 principles for costing an SBC cost study. And these are based on the Global Health Cost Consortium's reference case for costing. And they're organized under 4 categories around costing considerations for SBC with regards to design, measurement, pricing and valuation, and analysis and reporting. The web link here is available, and I would encourage anyone interested in using a costing study to use these when you're designing your study and to really think about it from the outset of your program study evaluation. To supplement these guidelines, we've also published 4 community of practice briefs, and these go into further detail on specific sub areas within the guidelines. The first is on the denominator and SBC costing, followed by a brief on sub areas to the guidelines, followed by one on SBC social media costs. Another looks at how to handle startup costs. And the 4th one is focused on costing for SBC for bed net distribution for malaria prevention. These can all be found on the Breakthrough Research website, and we will be adding a 5th brief on how to approach cost effectiveness of integrated SBC. And I can drop all these links in the chat at the end of the presentation. Next slide. In terms of synthesis, our literature review of SBC costs are currently being updated. We have approximately additional 50 studies to be added to the 147 cities that we first examined. The SBC unit costs have been incorporated into the Global Health Cost Consortium's unit cost study repository, available here on the website. And additionally, the full database is available on our website, the Breakthrough Research website, which includes further details on each study, as well as total costs in addition to unit costs. So with the UCSR, or the Unit Cost Study Repository, you can search by different types of SBC interventions or locations and see what other people have reported in the literature on the unit costs of certain types of SBC. Next. The other big area around synthesis is focused on business cases. We've used a business case approach to highlight the value of SBC, which can be less readily apparent than other interventions for several reasons, including that SBC interventions typically work through intermediate determinants. So our role in the business cases is to examine the pathways for impact via these intermediate determinants. So we start with the SBC interventions like mass media, IPC, et cetera, and we look at its impact on knowledge, attitudes, norms, and other determinants, and then link these to impacts on key behaviors like those listed here. And we combine these with the cost data to look at study cost effectiveness. But thus far, we've examined these pathways to modern family planning and malaria prevention, and we are currently working on one for nutrition with a focus on breastfeeding and complementary feeding. If you're interested in learning more about the details of the pathways to impact, I encourage you to take a look at the interactive infographic with the web link here that shows those pathways for family planning analysis. Next. When we're conducting the business cases, our approach is that by combining the findings of the impact literature with the available data on SBC costs, we can then explore investment scenarios and look at the benefits and cost effectiveness of SBC investments in country applications. It's important to recognize that when we're doing this work, that we realize that the costs, intensity, and effectiveness of SBC interventions can really vary substantially across contexts. But our aim is really to match the median impacts and the median costs and get an overall approximation of the cost effectiveness of SBC within a particular health area. But to be clear, we're not evaluating a specific SBC program with these business cases. To get an illustrative investment case scenario, we select a country and then we review the country documents, plans, budgets, et cetera, and also speak to in-country personnel to get a reasonable investment scenario that best approximates the scale and cost of actual SBC interventions that will be conducted over the next 5 years. And then using the impact data, we also project the changes in behaviors that will stem from this. Next. Once we've estimated the cost and modeled the impact, then we can examine the incremental cost effectiveness ratio, or ICER, by dividing the additional cost of an intervention by its additional effectiveness. The ICER we've been using is the disability adjusted life years, or DALYs averted. And we use this as a measure of effectiveness and benchmark it against the gross domestic product per capita. According to international standards for cost effectiveness of health interventions, if the cost per DALY averted is below the GDP per capita, it's considered a highly cost-effective intervention. And if it's below 3 times the GDP per capita, it's still considered cost-effective. Whereas anything over 3 times the GDP per capita per DALY is not considered cost-effective. Next. Here you can see the family planning impact results from the 5-year illustrative investment scenarios in 4 countries that we've examined. We look at the percentage point increase in modern contraceptive prevalence, the number of additional modern contraceptive users, the number of averted unintended pregnancies, and the maternal DALYs saved, which is also the DALYs averted that we use then for cost effectiveness. Next slide. When we combine these impacts with the costs, we can see the cost per DALY averted and compare them to the GDP per capita. We've included a sensitivity analysis that uses the interquartile range for costs and impacts. So you don't just get a point estimate, but can also look at a range of estimates. And you can see here that the median estimates for all 4 countries are under the GDP per capita, and thus they were all considered highly cost effective. In addition to the country's GDP per capita represented by the small gray line, we've also included the regional GDP per capita, excluding high income countries for sub-Saharan Africa, This is because some people have argued that the appropriate benchmark shouldn't be a specific country, but rather looking at the region overall. And you can see when we use this threshold, they're even more highly cost effective compared to this benchmark. Next slide. So we have received a lot of positive and useful feedback on the business case applications, both malaria and family planning. And we're in our next stage, we're excited to start a family planning business case and turning it into an SBC Investment Web Application. So this is currently under construction. It will allow users to specify their own investment scenarios and then look at the corresponding impacts and cost effectiveness results. This web app will be connected to Spectrum Online, and it'll allow users to customize the impacts and costs of their own program if that data are available. These results then could be used for advocacy, planning, and budgeting. And here the little steps on the slide outline show the process that a user will follow. Should note most of these steps will include default data that can just be reviewed. But again, if you have more data specific to your program, you can make this business case work uniquely for that by adding in your own unit costs and impact if you have that information. The key user input needed here will be specifying the SBC intervention types and the reach that you plan to do over the next 5 years. So we're really excited about having this web app available and letting people kind of conduct their own business case applications. And we're hoping to have this go live sometime, I think in late summer. The next slide. So looking ahead, we hope to see costing increase and having more costing studies out there that we can incorporate and learn from. As we look towards these investment cases and the business cases, we really see a potential for a broader SBC investment model that can really capture the efficiencies of SBC across health areas instead of looking specifically within one health area. So we know that, for example, that investments in antenatal care have cascading impacts on other health outcomes. And we also know there are a lot of common determinants to positive health behaviors that could be addressed simultaneously. So we think that, kind of looking forward, we'd love to see an SBC investment model that captures these efficiencies and can show even greater cost effectiveness and assisting with program planning and helping to really inform donor investments. So next slide. That's all I have today. Thank you.
Great. Thank you, Nicole, for sharing all of those resources. Those are really exciting. And of course, they will all go out with these presentations sometime either today or tomorrow. And of course, we look forward to seeing those other tools that you described at the end as well. All right, so on to our third and final speaker, Temitope Ogunbi. Temitope is a senior program officer at Johns Hopkins Center for Communication Programs, where he works on the Breakthrough Action Nigeria project, and will be sharing an example from the Breakthrough Action Nigeria project looking at an ITN mass distribution campaign. So over to you, Temitope.
Thank you very much, Tyler, and welcome everyone. So similar to what TCI has done in Nigeria with regards to improving government commitments and funding for SBC interventions, the Breakthrough Action Nigeria project has also been working closely with the National Malaria Elimination Program to improve government commitments for funding ITN campaigns. Next slide, please. Yeah, so like you all know, Breakthrough Action Nigeria is the USAID's flagship project for SBC. And the project has been improving the practice of 17 priority behaviors in the areas of MNCH, nutrition, family planning, reproductive health, malaria, TB, and recently COVID-19. Next slide, please. Yeah, so just like Dr. Omotosho had mentioned, domestic funding for malaria, and indeed for other health interventions in Nigeria, has been a perennial challenge. More of the times we see that funds are budgeted, but they hardly get released for interventions to be implemented. And we all know that the WHO has put out ITN use as a cost-effective measure for malaria prevention. During ITN campaigns, SBC is needed before the campaigns, during the campaigns, and after the distribution of the nets to ensure that, awareness is created, awareness is high, the population is properly mobilized for the distribution phase of the campaigns, and then that even when the nets are distributed, when they get into the hands of beneficiaries, that the nets are used consistently and correctly. So to bridge this gap, advocacy engagement with government and stakeholders has really proven to be an effective means of increasing funding, both in cash and in kind, for ITN campaigns in Nigeria. Next slide, please. So to achieve these engagements with governments and other stakeholders, the tools that have been deployed are, things like the campaign microplan. The campaign microplan is like a bottom to top way of planning for each state, looking at local context in terms of personnel, in terms of storage, in terms of other resources, both human and material, that will be required to distribute millions of nets to all the households in the state. Now, the campaign budget is another advocacy tool. From the campaign microplan, the budget, a costed budget, is developed that addresses all of the material and human resources that will be required for a campaign. We also use the end process survey, which sort of is a survey that shows the distribution of nets, the retention of these nets in households, the use of the nets among key populations like children under 5, pregnant women, and the general population. So the end process survey shows among key populations what the percentage of net use is. And like you all know, the target for every campaign is to have at least 80% of the target population using the nets after they have been distributed. Then we also have advocacy briefs that detail the prevalence of malaria in each of the states. And for instance, currently we're using the 2018 NDHIS prevalence data, using it to advocate to the government to show where they have been in the fight against malaria over the years. So advocacy typically targets the state governors. Like in Nigeria, we have 3 tiers of government. We have the federal level, we have the state level, and we have the local government level. So the state governors are the highest hierarchy of authority in the states, and advocacy typically targets the highest level of stakeholders in every state. We also have the state commissioners for health, who are in charge of all the health programs in a state. We also have the state commissioners for health, of course, because of the media angle. We also have the heads of other ministries that are allied, that are related to public health. And then, of course, we have the local government area chairmen, who are in charge of the local government areas in every state. Of course, the media cuts across all stakeholders, and they are a very important target during our engagements. So for conducting these advocacy engagements, the actors include the Minister for Health, who is at the federal level and is in charge of health, all the health areas across all the states in the country. Then we have the National Malaria Elimination Program leadership, led by the National Coordinator. We also have the Rollback Malaria Partners, donors, and then the ACSM core group, which exists both at national level and in each of the states. Next slide. Yeah, so in the process of engaging with these stakeholders, the very first step is the micro planning and budget development. So for each campaign, targeting every state. The first part of it is the development of a detailed microplan. And like we said, the microplan looks at an operational plan in the local context of the state where the campaign or where the nets are going to be distributed. So in collaboration with the national program and the state program, a microplan for distributing the nets is developed. And from the microplan, a budget, a costed budget for every line item, human resources, material resources, is developed. Now, this budget is finalized in collaboration with the Honorable Minister for Health at the state level and the State Malaria Elimination Program leadership. Now, during the micro-planning stage, a detailed advocacy plan is developed, and this advocacy plan looks at all of the relevant stakeholders across the sectors, health, private sector, agriculture, women, youths, and all of that. So it looks at targeting all of these stakeholders, including the traditional leaders, the religious leaders, and then a plan for how each of these stakeholders will be engaged, and then what asks will be presented to each of these stakeholders. Now we have the LLIN Campaign Coordination Network, which is a network of notable individuals cutting across the private sector, religious leaders, line ministries, agencies that are present in the state. Now this network is constituted to move forward with engagement with other stakeholders in the state along the line of implementing the ITN campaign. So from developing the micro plan and a costed budget, we move on to engagement with the National Malaria Elimination Program and the Minister for Health at the national level. Now this is at the federal level. So the micro plan details and the budget are presented to the Minister for Health, who looks at all of the details regarding human and material resources. And then an advocacy letter is drafted and sent to the state governor, signed by the minister. So the minister at the federal level is a highly respectable person. So when state governors, get a letter from the Minister for Health, it's given express attention, and there's a willingness and an eagerness to respond and then receive the team that will be engaging with the state governor. So from there, the advocacy visit itself or the engagement is led by the Honorable Minister for Health himself or a designate at the national level. So the Minister for Health or his representative or the NMEP national coordinator leads in the advocacy visit to the state governor. After the state governor must have, written back, selecting a suitable date to meet with the visiting team. And during that meeting, we have various levels of commitment made by the governor and other key stakeholders that will be in that forum where the governor meets with the visiting team. During that process, they present again the micro plan, the budget, and the LCCN also push for the state governor to make commitments with regards to cash and kind for supporting the upcoming campaign. Next slide. So over the years, I saw one of the questions in the chat area where we're asked about, what is the relative contribution when you look at the cost of an ITN campaign and the amount of funds that are released by the various state governors. Now, I'd just like to say that we're coming from a place where there were zero commitments, there were zero release of funds, So I think now we'll begin to look at comparing the entire cost of both the nets and the distribution of the nets relative to what the state governors are committing. So if you look at the results, you'll see that for various states from zero, the states have started to release funds in line with items or lines in the budget that they have chosen to support and provide counterpart funding. So you can see there's been a huge improvement in government commitments to funding ITN campaigns in Nigeria. And like I said, we're coming from a place of zero commitments to having these governors and the state government releasing these varying amounts of funds for supporting the campaigns. Now, apart from cash, we also have the government committing to free spots for radio and TV, where complimentary spots are given for paid spots by the donors. So you can see the varying amounts of complementary spots and the equivalent in dollars that they have amounted to in the different states where PMI has been supporting ITN campaigns. And notable is, for instance, in Nasarawa State, you have the state government committing to fully funding the microplanning activity. Now, this is the first in the history of campaigns in Nigeria. So all of these advocacy engagements have been resulting in, a high level of commitment on the path of the government. Next slide, please. And when we look at the reach and the achievements of these campaigns over the years, you will see that the number of nets that are distributed are in the millions, and then the redemption rate for these nets have been really, really high. And this has largely been in part to the kind of awareness that is created, the demand created, the media buzz, and all of these commitments that have supported in creating a high level of awareness around the campaign. So you can see the net redemption rates have been, close to 100%. And then we have varying levels of hanging rates among the different states. We also have the use among key populations like children under 5, pregnant women, and the general population. And this is where we talked about the end process survey reports. So in LGAs that have less than 80% utilization by any of these key populations, the end process survey report is used to advocate to the local government chairman to, release additional funds to engage town announcers, to engage mobile vans that will go around the communities to improve the net use among these key populations. Next slide. So what are those things that have worked, in the course of engagement with stakeholders and the government in particular? The advocacy engagements have been largely led by the federal government to the state government, and this is government-to-government interaction. And so there's this level of commitment that comes with government engaging directly with government. Then the detailed advocacy plans that contain specific asks for each of the target audience have also helped the state governments to be able to identify, what line items they can support, according to the micro plan that is developed for the campaign. Then, of course, the government-owned media in the states, working through the Ministry for Information, most of the times the government have retainership with these media houses. And so government is able to, reach out to the ministries of information who have some level of control over the radio stations and the TV stations to get them to donate complimentary spots in addition to the spots that are paid for by PMI. Then the government, because the campaigns happen and every single household in a state is targeted. And so the government sees this as an opportunity to show how committed they are to improving the health and well-being of the people that they serve. And then, of course, the detailed budget enables the government to appreciate donor support. And not just the budget this time around, even the advocacy briefs showing, what level of investment PMI has made in each of the states in terms of malaria. So not just malaria prevention, but also diagnosis, provision of RDTs for testing, ACTs for treatment, training of health workers. And I mean, this investment is quantified and it's huge. And so the government is able to appreciate all donor efforts and then is motivated to also, commit to funding some of these SBC activities and malaria activities as a whole. Yeah, so in a nutshell, this is how we have been able to engage the government and all of the things that have worked, resulting in a high level of commitment for SBC activities and malaria in PMI-supported states in Nigeria. Thank you very much.
Great, and thank you, Tope. Now on to the question and answer portion. Please feel free to continue posing questions in the chat function. We'll use some of these questions that folks have been contributing so far in the chat function and start with those. I'll just ask for our presenters to all turn back on their cameras, and we'll ask questions in panel format. So I think perhaps the first question might be this last one posed, and a question I think we've all sort of skirted around. And Nicole, in your presentation, you talked about directly about the fact that so much of our funding comes in silos, and so much of the work that we do is in silos. And of course, two of the presentations were really malaria focused. So how does this budgeting and how can this costing extend beyond just one health area, such as malaria? Perhaps a question for you, Nicole, and for both Olukunle and Tope, about how you've worked beyond just one health area as well.
I mean, I can just speak to the fact that we know that malaria interventions tend to be very cost effective, primarily because malaria heavily impacts children. And so in our malaria business case, we did find it was, really highly cost effective. And thus, I think it makes it an attractive place for investments for government. So I think on our part, at Break the Research, we're really trying to demonstrate that investments in other areas of health are also cost effective. I think it's just sort of kind of well known that investments in SBC for malaria, is a really good bang for your buck in terms of investing in public health. So I think on our part, we're just trying to demonstrate that's true across health areas. And as I said before, we'd really like to see the field going, or our work extending into looking at how the integration across health areas can really even help leverage funds even better. But I'll let the other presenters speak to sort of engaging with governments and how that's been for them in terms of other health areas.
All right, thank you very much, Nicole. So just to add to what Nicole has said, so currently on the BAA project in Nigeria, in the states where PMI supports, we have what we call ACSM core groups. So the ACSM core groups are not specific to just malaria alone. You have other implementing partners for SBC across all intervention areas in the ACSM core groups. And then in some of the states, they already now have like an integrated technical working committee for SBC in the states. And so this doesn't just cut across malaria. But I think that the success we have achieved in malaria over the years has started to trickle into other health areas. And so we have now other interventions, developing costed work plans, presenting it, and engaging with the government from national level, government to government, and also achieving similar results. Thank you.
All right. Thank you very much for the question. Just to add to what other presenters have said, to be able to incorporate this intervention across other program area, what we did was to put this into the process from the start of intervention. So when we started the formation and the strengthening of the SBCC Technical Working Group across the states, we ensure that other partners who are working on other projects like malaria, HIV and AIDS, immunization, and other reproductive health interventions are also represented on the SBCC Technical Working Group. So when the Technical Working Group was developing the costed strategic plan, they incorporated all of these activities so that as they move with the annual operational plan, they were able to bring into the state annual operational plan all the intervention area around SBC, cutting across other program area into the AOP that the state had for implementation in the following year. That was the first thing we did. The second thing we were able to do was also to see how to leverage on the capacity of the SBCC Technical Working Group members, because we built their capacity. Although The Challenge Initiative project, funded by Bill and Melinda Gates and implemented by John Hopkins, is family planning centered. We use family planning as the entry point, but it was not limited to family planning. So the strategic plan developed by the states incorporated all the other service areas, and we also strengthened capacity of the SBCC Technical Working Group. And I can cite an example. In Rivers State, as we speak, the capacity of the SBCC Technical Working Group has been strengthened, that the state now use this member for COVID intervention. So it's not only for family planning, and at the same time, when there is immunization, the same set of people will also come on board to work for immunization. So this has been done in a way that they could work on any service area for integration and also for cost efficiency. Thank you.
Thank you, Olukunle. And thank you for the additional questions, and Tope for responding to some of those. I see Victor has a specific question about documenting commitments from government, as well as including contributions from other programs and investments. Perhaps for Nicole, within the costing models and cost effectiveness models, is there a place to include investment or contributions from other programs?
Yeah, I mean, what the cost effectiveness modeling is really doing is it's trying to look at, you know, to what extent are you going to, how many people are you going to reach with SBC, and how much is it going to cost to reach those people? So you can include that through a variety of partners or different donors, et cetera. It's not really necessarily gauged to like one set of actors, but is meant to try to get a sense of the unit costs to reach a certain person or people in the community. And then when we have those costs, we can then look at the translated impacts and the delays averted. So I'm not sure if I'm really answering the question, but basically saying, you know, that work can be funneled into specifying the unit costs, and then also thinking about that, you know, how does that translate in reaching more people with the SBC interventions. So I think it can be incorporated. Really, the foundation are the, you know, the impact is what we take really from the literature, as well as the unit costs. But these are all adaptable to specific situations if there's an interest in doing that. And an activity that wants to focus that way.
Yeah, thank you for that. Something I was thinking about throughout the presentations, I really appreciated the example from TCI and the example from Breakthrough Action Nigeria, especially the really descriptive process of what that advocacy really looks like, and breaking down all of those pieces for us. Especially for folks that might be less, have less experience in advocacy. Something I'm curious about, what have been challenges you've faced when working in advocacy and communicating effectiveness and costing information to stakeholders and to decision makers? Are there any lessons that you can share with the audience? Any takeaways for folks?
Yeah, so thank you, Tyler. You know, for Nigeria specifically, we have a lot of, you know, bureaucracy when it comes to, you know, dealing with the government. So for instance, we're currently implementing an ITN campaign in one of the states, and we've had to like reschedule some of the activities for the third time running. So, I mean, you know, and all of these have been bureaucracies around, you know, reaching out to the government. You write some letters, it takes a while, you know, for you to get a response and all of that. So yeah, so these are some of the challenges, mainly bureaucratic bottlenecks that you experience in, you know, trying to reach the government.
I think we can all empathize with that. Anything to add, Olukunle or Nicole?
Okay, just to add that, over the years, we have seen what's at work and what needs to be worked on. When it comes to what has worked in the area of advocating for finance, for SBC and other intervention, we have seen that having a system or a structure that could continuously engage with government, which is a non-governmental body, really works. And I can cite an example of what we have tested in TCI. Across the supported states where we work, we have what we call the advocacy core group. These are stakeholders across the different sector of life. You have people from religious body, you have media practitioners, you have government partners, and you also have retirees from government organizations. They all come together, put their head together, and work with the government personality and meet them to get information on the timeline for memo writing, the timeline for budget funding, the timeline for releases, and all the rest. So once they get information around this, what they do is they strategically engage with government around the time of memo writing and also around the time of budget planning and releases, and they follow the money through. So time will not permit us to be able to go deep into a lot of learnings that we have seen in the area of advocacy working group. Yes, bureaucracy is still there, but we are able to navigate around every one of these. Thank you.
Yeah, thank you, Olukunle. I think the advocacy core group is a great model. And for folks that have not heard or read about that, I would encourage you to do so. I see we're already coming towards the end of the hour, so I would just like to give each of our presenters perhaps one last chance to say any last final thoughts before we close.
Okay, I want to appreciate all the participants for taking out time to attend this meeting. And I believe that we've been able to learn one thing or the other. I will encourage us to check some of the links and visit TCI website for additional information. And we will also be available to provide any other further clarification you might require. Thank you very much.
Thank you, Olukunle. Tope?
Yeah, so just, thanks everyone for, taking out your time to be a part of this webinar. We definitely continue to share learnings from the BA project in Nigeria, and we encourage you to stay tuned to this SBC platform. Thank you.
Thank you. And Nicole?
Similarly, I just want to thank you guys for having me participate. It's been really interesting to learn sort of the advocacy side. I, of course, whenever I'm presenting, I always try to make a plug to encourage people to look at the costing and to do costing studies for their own programs. So that really helps build the literature base and helps us, kind of synthesize that information that can be used for advocacy. So I just wanted to put that plug in there. So thank you.
Thank you, Nicole. And I think we're all excited for those couple of resources that you described that should be coming out at some point soon. We'll keep our eyes peeled for those. And of course, thank you all of the presenters for joining today. We know how busy you all are, and we really appreciate you joining us for this important conversation. So thank you all, and thank you to everyone who attended today. Be sure to watch out for future Springboard events. All right, so thank you and have a great rest of your day.
Thank you.
Thank you. Bye.
Bye.